Here comes, here goes. We have so many doctors loitering the streets without employment. We have so much shortage that equation boggles the mind. But you know, the government wouldn't have the resources of employing doctors and doctors alone. Must get some funds for doctors, teachers, and security personnel in the country, engineers, lawyers, economists, all those. Same cake. What am I saying? I think we need not to be discouraged by the sheer size of the challenge ahead of us. The best we can do is to bring thoughts together and strategize on how to provide quality services even when we are so few. And for the longest period of time, this is not going to be matched with a corresponding income in terms of hours spent with these patients. Now, I have no intentions of running for any political seat next year. So don't be scared. I'm just being realistic. You are my friends. I'm simply making myself at home. Yeah, we need to help each other. Ni lazima wagonjwa wapate the best of care kila tunapofanya kazi bila kuwabagua. Na kazi hii inaanzia emergency medicine. A little bit of history. Before a majority of you even understood the term emergency medicine, we heard the word fire. What was that department at Muhimbili as we drove in? Casualty. Can you imagine casualty department? What was the meaning of casualty? I've had problems even understanding why it was named casualty. Si tunasikia casualty wa war, wa accident, sijui wa shooting. All right. Sadly, it was manned by people who had issues working in other departments. So we would go there, kichwa kinaniuma, Moisela. Mugongo, Moi. Siku zile ilikuwa ni orthopedics. Mtoto, pediatrics. A and B. That was the only responsibility they would do. No stabilization or whatever. But I think some smart people looked at the situation, and after having been exposed abroad and saw how these patients were coming to hospital were being handled, they suggested to the government the need to initiate a department that will address patients that were coming to the hospital. So that was Professor Mofongo, and then Professor Lema came to the office. But the government did not have money. And so this story cannot be complete without talking on the role that Abbott Fund played in this country. And much of the good things that we see shining at Muhimbili were built on that foundation. So Abbott Fund provided the support that enabled the beautiful picture that you presented with the first cohort of emergency medicine physicians to train here, and some of them were taken abroad to go and see real life how things happen. Now, you know, it's public knowledge that Mpoki loves traveling. I don't know who doesn't, but anyway, that's for tea break. Do not limit yourself to this country. When opportunities present, travel. Au baraka nimekosea? Enda kaone kitu inaendaje huko duniani bwana. Because you may think you've seen it all at Muhimbili, kumbe ni vile hata hujaanza kuangalia. Ramadhani alikanyaga tu hapa bondeni, South Africa. He came back a different man. He almost changed his name. I hope you're getting what I'm saying. We need to benchmark against the very best katika dunia hii. And with time, do not ignore the presence of people like Dr. Fire. They will give you more wisdom because of the advantage of living a little longer than the rest of us, but also being exposed from where we started to where we are. And they will guide you appropriately where you're supposed to go. It is important that each one of you desire in your own hearts to set aside funds to travel. You will wait your whole lifetime if the government is be the only sponsor for your traveling. Yani wewe si ni daktari, si ndio wandugu? Hii darasa ya leo iko au ni vile mfungo? Sijika kwa ni mfungo imefinyilia watu hapa bana. You all are doctors, si ndio? You need to think beyond the environment where you are working. So for those of you who are in Dar es Salaam may not be making a lot of money, hata enda hapa Nairobi tu basi. Angalia tu vile Wakenya wanafanya hivyo kitu zao. If Nairobi is too common, watu wataona umefika duniani, enda South basi. Because we have contacts. Lakini ni vizuri mwende Uarabuni, muangalie watu walivyo invest kwa health, mwende India. Sisi tunapeleka wagonjwa wengi sana India. Nendeni mkaangalie what is so special with India that everybody wants to go to India. Just go there and learn. Look at how they're doing things. Now India is very nice because while their medical industry is world class, their socio-economic setting, you know what I mean? Yeah. It's a very, very nice place to learn. But I mean, if you have a visa for the US, alikukataza nani kwenda huko? Si ukanyage tu ile nchi ya Biden. Angalia vile watu wanafanya. I'm very sure you will come back with a better refined mind than if you had stayed here. I'm warning you, a majority of the people that oppose the efforts that we put here to improve the health delivery system are people, Elisha, who have not gone out of this country. Au fire nimekosea. These are people who don't know, and so they pride in their ignorance. Baraka uongo hiyo. Number two, we need to read ourselves. Each one of us here must be a permanent, perpetual student. Technology is changing so much. Yes, listen to what your friends are saying, but please read on your own. Take notes. And thank God these days our gadgets provide us with access anytime, all the time. All you need is fund your bundle. Maybe you don't have money to register with ChatGPT 4, but even 3.5 can open your mind. Duogal is another one that answers all the medical questions. Go there, ask questions. All right? There's also Gemini, I'm told. So the sky is the limit. Read something. Now, this is going to be very, very dangerous. Do not always strive to remain in this country for work. Mmesikia kitu nimesema? Nimesemaje? Yes. USLME, you pass, you are qualified to be employed in the US. Sasa ndugu, huko US wanalipa dola. Dola moja ni shilingi ngapi ya kitanzania? Almost 3,000. Sasa ukienda mahali Sankara, hiyo mali yenyewe ndugu yangu, huku Tanzania tunahesabu kwa 3,000. Wewe ndio change yako. Okay? And then be a bridge to others. Yazana sasa unajua nilichotoka Ministry of Health nimeshaenda Canada naanza ku okay? Countries such as Canada, they have so many opportunities for employment. The only problem is that people do not want to go through the hassle of qualifying for employment in this country. You need the skill set that you have. You need to pass the exams. Try. The only trouble, we've left Nigerians, Kenyans, Senegalese, Ghanaians to be the only people to overpopulate those places. I was surprised in Canada, the northern territories, where you have Yukon, Northern Territory, and the Inuits, there are people from Nigeria serving there. The coldest places on earth, they stay there. There are people from Zimbabwe. Because some of you are already thinking, but Nigeria is very far. Zimbabwe. But there are Kenyans as well. So I need to encourage you to look beyond the borders of this country. We need to export the manpower, the human resource for health. You know, for those of you that are already qualified, it's very easy for you to settle in those places. When you leave, you'll create space for those that are unemployed in this country. Ubuntu spirit, kile uko nacho, unampeana na mwenzio. It's necessary that we create such connections. But, the health commodities at our disposal must be guarded with jealousy. Vitendea kazi. Sisi tuvilinde kwa nguvu zetu zote. Because you might be the next patient to require the use of such equipment. Be it a defibrillator, a monitor, a laryngoscope, a chest tube, those kind of things. There's one area that I also think we need to think critically in investing upon, the nursing skill set. Elisha, you don't sit in the nurse midwifery council, but it baffles my understanding and thought that we are investing in a master's program that offers critical care and trauma while we do not have an undergraduate degree in that field. I thought it was a diploma, then we go to an undergraduate degree, and then a postgraduate degree. But we've started the other way around. We've started with a postgraduate degree. When I was in the ministry, I tried to have them come up with a bachelor's degree. That's not the material for now, but okay. And then, without the nursing staff with the skill set in caring for the critically ill, we shall have wasted our time. The reason for this is because nurses care for the patients when doctors are not there. So we need to invest in them deliberately. You people here are the champions. You need to champion that cause as well. Yes, we work with several. Dixon, you know, we work with so many nurses in the ICU, but are they as skilled as Keisha? Yeah, truth be said, Sankara, you know what I'm talking about? Yeah. Baraka, we have a nurse. You need to be careful before you start saying that's not right. How did she get that knowledge? She simply learned. So we need to encourage the nursing cadre. But the other area that we also need to invest heavily upon are the physiotherapies to support critically ill patients. Each institution. I don't know if we shall standardize the equipment in the country. I don't know. But you have to remember that the further away you move from what is common, the more complicated it will be to service such equipment. I'm not trying to promote any product. Nataka tu niwachie mufikirie. If we go to the automobile industry, this country is loaded with many Toyotas. As a result, you can service a Toyota anywhere in this country. Sasa wewe chukua BMW yako tuipeleke Unyakyusani, ikafeli huko. Si utapeleka gari ya kubeba hiyo gari? Yet a Toyota, even a big Toyota like the one I'm driving, chini ya mwembe mtu anakuambia no bosi, huko engine natugusi lakini hii hapa ndio inatoa upepo. Tutafunga alafu kifika mjini watakutengenezea, gari inaenda. The same thinking must be employed when we decide on which equipment to bring to the hospital. Ask your neighbors in the region. Kama Dar es Salaam, nyie mko na ventilator gani? Oh, sisi tuko na Savo Maki. Okay. Huduma yao wanajitahidi, kila wiki wanakuja kuangalia. Dixon, nyie mko na gani? Hiyo hata jina yake hatuijui bana. Sisi tuna kitu inaitwa Hamilton. Si ngapi? Sijui si 2. Iko mzuri. Mwingine Drega. Hapo ni mkoa mmoja tunazungumza. Mwingine anasema hii tuko na ventilator hata jina yake hatujaijua, iko hapo. Sasa ikiharibika sasa. So remember, they have a half-life, and that half-life determines the service you're going to draw from them. If we are going to buy machines that are not adequately serviced and supported, the care that we need from them is not going to be optimally obtained. This conversation cannot end at this point. But all I've simply said here is that human resource for health building or development is the only solution to bridging the gap of critical care and emergency services in this country. How do we do this? Each one of us must be deliberate, must be intentional. Institutions must be ready and willing to sacrifice, to have people that are going to offer treatment like Muhimbili discovered, and the ministry testified that wagonjwa walikuwa nakufa sana Muhimbili, lakini toka tulipoweka emergency medicine vile vifo tuvioni kwa wingi. Simpige hata makofi kidogo kwa hiyo. That is what you and I are supposed to invest in, and that's what each one of us is supposed to live desiring to achieve. So this symposium is simply to empower us to help deliver quality services in those facilities that have cost a lot of money to build. Don't forget, our existence in this world is finite. So as you are being developed, remember to develop others to come after you. Because I'm trying to imagine if Dr. and my Professor Ipuge here had not encouraged us to do serious microbiology, a resistance pattern in the ICU would not have come. And now I'm looking back, and I'm looking at my students, and those are going to look at others. Let us hold each other and move forward. And for sure, this symposium on emergency medicine and critical care will be a force for change, not only now, but consistently in this country. God bless you as you deliberate and meet this year. Thank you very much.